And I said, I want to die with peace in my heart, because I have been so privileged to see so many people die. I have been at the end of so many people's lives and held their hand, and I have heard their last words. And they are very frequently, I wish I'd have looked after my body. I wish I'd have given more time to my loved ones. And the other one was, I have so much more I need to do. I don't want to die saying those words. I know if I die now, I won't say those words. I have found some peace in my heart that only my healing journey has brought me through being more, how am I feeling rather than what I'm thinking.
Today, I'm joined by the incredible Angela Bence, an advanced nurse practitioner with a wealth of experience spanning 40 years across many specialities. Angela's expertise is vast, but today we're diving into something even more personal, her own health journey. From a traumatic childhood to overcoming significant challenges and transforming her well-being, Angela's story is one of resilience, healing, and empowerment. Join us for an inspiring conversation about reclaiming health and the power of transformation. You won't want to miss this one. But before we dive in, I have a quick 60-second favor to ask, and that's to subscribe to this podcast and sign up for the 51% community on our website. It's free and makes a huge difference in helping us bring even more incredible guests and host impactful events for our community. Now's the time to step up and take control of your health and wealth with practical steps that fit your life, backed by a supportive community, and I can't wait to see you at our events. And finally, a quick but important note, the views shared in this podcast are for informational purposes only. They don't replace professional, medical, or financial advice, so always consult a qualified expert for personalized guidance. Angela, welcome to the podcast. I'm really glad you came on. You have had the most incredible journey. I know we've talked before this, and I was super inspired by everything that you said, everything that you do, and your journey to what you came from to where you are now. It is absolutely inspiring, and I really do hope my listeners get something out of this. I'm absolutely sure they will. Please, could you introduce yourself and talk a little bit about your journey from where you were to where you are now? That would be great. Thank you so much.
Hello, Sher. Thank you for inviting me today. Yes, my name is Angie. I'm 58 and I have a lot of fancy titles. I'm an Advanced Nurse Practitioner. I'm also a Clinical Pilates teacher. But the main purpose of you inviting me onto this podcast was I have this kind of elevator pitch of I was a 20-stone alcoholic addicted to 10 prescription drugs facing immobility. And that story is very true. You know, I have had a life where I've spent 40 years really in the NHS as a nurse. And during those years, my weight has been up to 20 stone. It has been as low as 8 stone. And I have spent most of my life medicated, whether that's medicated on alcohol or prescription drugs or abusing food, it is there as facts. And 6 years ago, I was done for drink driving, which was a massive wake-up call. I couldn't even do a breathalyzer, so I actually got prosecuted for failing to provide a specimen of breath. But regardless, I was an absolute mess. I was practically immobile. My husband was caring for me. He had to wipe my bum at times. The GP said, if your things get worse, we'll get you a wheelchair. I was looking at taking my pension early. And so this was a massive wake-up call. I literally got done for drink driving. I got banged up in a police station for 10 hours. I'd worked in liver transplantation, I'd worked in drug and alcohol addiction, and so I considered myself a bit of an expert on alcohol. Well, I was, and I had tapped into many AA and Aquarius and counselling. But this was the icing on the cake. I mean, at the time, I absolutely didn't care if I died or not, and I wanted to die. However, I didn't die, and this was my wake-up call to say, we've got to do something about this. And I knew that I'd had a horrible childhood, and I knew that my brain wasn't wired up correctly, for want of better words. So I delved, and I've always got a keen interest in psychology, so I delved into psychology. And one of the first books I picked up was The Chimp Paradox by Professor Pete Stevens, a famous book, and realised that, you know, there's a lot more to brain training and psychology. We've got more knowledge now. And so really delved into psychology. And one of the first things I did was I visualised that the drink driving offence, I actually just reversed out one morning and hit a neighbour's car. But what I visualised was that that was a child, and that I killed it, and that I was in prison. And that was a pain that I couldn't live with. So that was my motivation to say, look, you've tried to moderate for decades with alcohol. Enough is enough. If you don't kill yourself, you will kill someone else. So I started delving into psychology, and I knew to stop drinking. And like I say, over the many, many decades, I knew I had a drink problem. I tried to moderate. I'd gone to AA meetings. I'd gone to Aquarius. I'd gone to my GP. I only ever went to my GP for help. You know, I thought this man was going to save me. And I'd had lots of counselling. I'd had lots of therapy. I'd seen psychiatrists. I've had bulimia nervosa. But this time I chose a neuroscientist. I like science. I come from a medical background. So everything I do, I like to back it up with some kind of science. So I picked a neuroscientific way of stopping drinking. A woman called Annie Grace. She has a program and a book called The Naked Mind. And I literally listened to her for half an hour a day for a month. And when I realised what the alcohol was doing to my brain and the fact it was going to stop me rewiring what I wanted to do, that was it. It was a no-brainer. I stopped drinking. And it was quite simple. But then after 30 days, I realised my mind wasn't naked because I was on 10 prescription drugs, you know, including morphine, Oromorph, gabapentin, and benzodiazepines, zopiclone, you know, numerous drugs for pain and mental health. And I thought, I want my brain to be naked. So this was a time when I took a year off and the drugs went off. I detoxed myself. I didn't take any advice off doctors. I mean, I'm a prescriber, so I understand pharmacology. But I literally, and then I also read a really good book called The Pain-Free Mindset, a great NHS consultant, Deepak Ravindran. And I realized the drugs were not working anymore. Why didn't they work? Because my receptors were not working. So again, reading his book, I realized that as the drugs came off, I had to replace them with something else. So over a period of a year, I replaced alcohol with Clinical Pilates. And this was all expensive therapy, but I didn't say I had any choice, really. I took that year off and, you know, I couldn't work anymore. So what choice did I have? So the alcohol went out and in came Clinical Pilates. And then as every drug came off, I replaced it with something else. So there was breath work. I took myself off to the Buddhist temple to learn to meditate. I discovered things like iced water. I pushed my brain to do things like jump out of a plane, walk out over fire.
Wow.
And face my fears, really. And over a period of a year, I became drug-free, and I have lived addiction-free for over 5 years. And obviously nutrition's played a massive part in this as well. Healing foods and connecting into our body. So it's that mind-body connection, what I always heard about, but I had no idea what it was. And so I connected my mind and body over a year.
Yeah. How long did that take from the moment you got done for drink driving? How long did it take from then to where you are now, or to the point where you felt that you had transformed yourself? And I know a lot of these things are still work in progress. And also, from that moment where you thought, you know, you had the accident, you were done, well, not accident, sorry, you were done for drink driving. If that didn't happen, do you think you would have continued as you were?
Yes, I do. I do. And I think, you know, when I look back at that moment, I remember being in bed for a week after the drink driving, thinking, what the hell am I going to do now? And I was terrified, absolutely terrified. And I would say it took me a year. It was only when my mind became naked and I had no drugs on board and I was no longer reliant on repeat prescriptions and things like that, and that I felt free. And I realized I could move in a pain-free way and I actually didn't need these drugs. And then, of course, after the year, my mission became, I want to get stronger, I want to get fitter. And also as well, this massive realization of why I'm on this planet and who am I? That was a big question. Who am I and what am I here for? And what is my purpose in this universe?
How did you go through that process? What did you do to figure all that out?
I laid under the stars one night on a mat, and that is, my mind is on the mat now. When I get my Pilates mat out, yoga mat, when I'm there and start doing my breath work, I'm really connected into my body. And I was on a nutrition retreat in Cyprus, and I was looking at the stars one night, and I felt this immense amount of power and energy that I can't explain. And I'm not religious as such. But then I realized I'm there because we're all suffering on this planet in some way. And my story is powerful. And my mission now, I've healed my body. I'm healing. I'm always healing. I'll be healing in the grave. There's always work to do. I'm healing my mind. I'm healing my body. And I thought I'd been healing people in Western medicine for 40 years. But really, all I've been doing is creating health anxiety, medicating people, referring for unnecessary surgery. I mean, don't get me wrong, I've saved many, many lives and done some good work. But generally, I felt then the universe was giving me a message because I should be dead. The drugs and alcohol I've had, I should be dead, absolutely. And I've been blessed now with really good health, no medical problems. And so I reckon the universe sent me a message that my job is to continue to help to heal people, but from my heart, with compassion, and to understand where they are, because whoever comes to me, I have been where they are, and I was stuck. I was so stuck, and so many women, so many people are stuck. We tell them to lose weight, stop drinking, but they don't know how to. They don't know how. And so that was when I realized the reason I'm on this universe is to help others that are suffering. And also I need to find teachers to help me continue my journey. And that's one of life's difficulties, finding good teachers and good mentors to help us. But the important thing is we need to help each other, because that's what we should be doing as humans.
Yeah. So you talk about you working on the NHS, with the NHS as a nurse. Can you give me a bit of context on how you got there in the situation you were? You know, I know there are lots of reasons why people end up the way they are. Can you talk a bit about that?
Well, I have to say that, you know, when we talk about childhood trauma, which we call complex PTSD or CPTSD, which I have, then part of my journey of the brain training, the psychology, was to get rid of all these awful diagnoses of borderline personality disorder, depression, anxiety, and get a correct diagnosis of CPTSD and have the correct trauma therapy.
How did you do that?
reading and knowledge, and the universe sent me an amazing therapist who does EDMR, which is specific for childhood trauma, and that was life-changing. And when you understand about CPTSD, you realise that a lot of nurses go into the profession because they've come from trauma. A lot of people in the medical profession, when you've come from trauma, you feel this sense of purpose that you don't want others to suffer the same pain that you have. So you go into a job like nursing where you feel safe. I mean, my mum had Munchausen's by proxy, so she was always harming me. So I only ever felt safe in hospitals around nurses or police officers.
What could you just explain what that is?
So Munchausen's by proxy is when somebody has a mental health condition where they get pleasure from harming a child.
Right.
So my mum would nail hammers into my hand, and she smothered my brother at 10-month-old and killed him. And back in them days, she was let off the courts because of mental health problems. But she frequently harmed me from birth and medicated me and was, you know, I went through horrific abuse. She was a sex worker. So we lived in a very poor caravan, and the people that should have saved me, for want of better words, like the police and the social worker, were all male, and they were helping themselves to her services. And so I spent most of my childhood living under a caravan, starved and neglected, living on crab apples and earthworms. And the only love that I ever had were stray cats and kittens that would come and snuggle up to me. And that was the only safety I had. And then you kind of fast forward that my mum died when I was 15, which was a blessing. And then I was put into foster care. And they were unloving and uncompassionate and just wanted me for the money. So nursing and going into an institution like the NHS was my home and my family.
I guess it's almost like, you know, you built up a community there, a community that was like with like-minded people that have perhaps gone through similar things or have, you know, some form of trauma that they've experienced. But I guess it's probably not discussed, but you just feel that warmth and that community around you when you're working there.
You do. And, you know, back in them days, we had matrons, and they were a very good mother figure. But then looking back now, the consultants and the hierarchy of the male doctors, you know, and I remember, you know, pulling my back within weeks of being a nurse, and them saying, oh, you've slipped a disc, you'll have this for life, and here's some painkillers, you'll probably have to stay on these for life. And, you know, these powerful, rich consultants, I believed every word they said. I never questioned them. I had no education. I didn't go to school until I was 15. And so I thought these intelligent, powerful people knew everything. I didn't need to question them or even read outside that box. So, you know, I was, you know, Western medicine is very black and white, and it's been set by very old laws, predominantly to protect us from being sued. And so, you know, you end up being a normal nurse where you can do the basics of just caring, which I love, the bed bathing and looking after people that were genuinely sick. But then over the 40 years, you know, we've seen a massive change in culture where people are getting more overweight, more addictions, more Western man-made diseases, more drugs coming on board. And then, of course, I spent a stint in time when I worked on in liver transplantation and hepatitis, and worked for the pharmaceutical industry in clinical trials. And I genuinely thought these lovely people were there to make people better and cure diseases, you know, but that was my naivety. But again, it was only when had my year off and I was rehabbing myself that I really opened my eyes to what Western medicine is about. And sadly, it is predominantly now about pharmaceuticals and money.
Unfortunately, you know, when you do go and see your doctor, it's almost like you're given a Band-Aid, which is either paracetamol or ibuprofen. Now, you know, I'm not saying that Western medicine and pills don't have a part to play in your healing process. And of course, there are circumstances where you absolutely need to have certain medication. But there are also other things that you can do at the same time, which is what you did. You know, you took it upon yourself to get the knowledge, to learn about different things and to find out different things that you can do to heal yourself, which, you know, started, I guess, when you were done for drink driving. You know, you talk about being overweight and being an alcoholic. Was that during at that stage with your mum going through all of the problems with that, or was that after?
I guess it was after, because, you know, my mum pretty much starved me.
Right.
And so, you know, food was a scarcity, or I'd beg people for food. I get food if I went to a police station, I'd get food. So, you know, when she died when I was 15, and I realised the foster people didn't love me, I didn't want to be there. So I quickly got a job in a pub cooking food. And all of a sudden I was surrounded by food. I started eating and eating and eating. And then, of course, I was earning money, and I'd spend my money on food, cream cakes. And then, of course, with bulimia, you know, I'd go and eat a loaf of bread and 6 cream cakes, and then I'd be disgusted at myself, which is what happens with CPTSD. We're full of self-disgust, self-hatred. We feel worthless. And my mum had taught me to vomit. You know, she said, you know, this is what you must do after food. She had lots of mental health problems. And so I was vomiting and then taking laxatives. I'd be sometimes incontinent of diarrhea from how many laxatives I'd taken. And it was just a complete cycle. So, and again, I saw a psychiatrist, I think at aged 18, about my bulimia. And I think back then she just kind of said, well, you've got to get over it. There was no compassion, no understanding of trauma or why I was doing this to myself. No questions about my childhood, which a lot of therapists, you know, we really need to, you know, talking about your childhood with CPTSD doesn't help us. It has to be trauma focused. But we have only started talking about trauma in the kind of late 80s, 90s, and it's getting more evident now. We can talk about it in the NHS now. But the food just spiraled. I just wanted to be what society's telling me, which is a size 12 or whatever. And I would do anything to be that size 12. So I got bulimia and then managed my way through vomiting and laxatives for many, many years. And in 1998, I was sat on a bed in coronary care telling a patient to lose weight, and his wife turned around and said, you don't practice what you preach. And I got on the scales and I was just under 20 stone. And I literally lost 10 stone in a year. And back then I think I went on 1,200 calories a day, which I wouldn't advise now. I don't like calorie counting and I hate the word diet. But that's what I did then. And I lost this 10 stone being so strict with myself. But I had, you know, and so I came out of it, oh, wow, I'm super slim. I've got a lovely figure. But I'd still not done any exercise or discovered movement. I'd done no brain training. So the underlying problems of that, why was I overeating, you know, and when I'd gone on that year diet, I was still smoking cigarettes. I was still drinking alcohol. I'd have some prescription drugs. So there was always something there in the background. So inevitably I lost the weight, but not overcome my food addiction. And so then there was many decades of abusing slimming tablets. There was the amphetamines available from the GP, you know, abusing and any slimming, you know, cabbage soup diet, Slimming World, Weight Watchers, all these kind of things that I absolutely disapprove of now. And then, of course, along came Skinny Jab, which, again, I absolutely, you know, discourage any woman from jabbing themselves. And my food addiction was only cured about 5 years ago. After my 1 year of rehab, I took myself on some retreats and I went on an amazing nutrition retreat in Cyprus. You know, we are monkeys, we're primates. We're designed to only eat certain foods. but we live in a lazy world where we're given all this ultra processed food that's highly addictive. But after a week of eating organic, vegan, really super healthy food, and changing my eating habits, we don't need breakfast as humans. We should be foraging in the morning and exercising. So, a week of really good nutrition and somatic movement connected into our body. I came back from that retreat and I couldn't eat the same again. So, I do see myself as a primate now that knows what it needs to eat. And so instinctively, I will choose foods and turn my nose up at foods. And my food addiction is cured, and it's life-changing because I don't have to worry about weight. I'm not on a diet. I enjoy eating. I find it quite difficult to eat out, etc. But that's just something that I can overcome by keeping food with me in my bag and things like that.
Just taking that time out to think and to, use your brain in a different way. And I think, you mentioned lying under the stars, okay, and looking up, and that was your moment where it was that moment. And I really think this is a problem now. We're so, on the go and want instant gratification and want instant everything. We don't take time out, whether even if that's 10 minutes or an hour, for our brains to just be still and to just things to flow through without having to think about going here, going there, doing this, doing that, cooking, cleaning, going to work, kids, whatever. And I feel like you just saying that, taking that bit of time out has really transformed you quite a lot.
It has. And the words that are coming to mind now is we need to feel more and think less.
Yeah.
So when I was laid there under the stars, there was nothing to think about. And all of a sudden, that feeling in your body, and this is what healing is. This is trauma healing. When I'm doing therapy, how does that feel? Where is that sitting? Is that emotion or pain or discomfort or tightness? Is it in my heart? Is it in my stomach? Is it in my jaw? Is it in my chest? Do I need to run away from this discomfort? No, I need to friend it. This is my body. These are my memories. This is my history. I can numb it as much as I want with drugs and alcohol and food, but I know where that is going to leave me. That's going to put me in a wheelchair or a prison or a cell or on medication. So, years of medication, of numbing this pain inside me that I didn't want to live with because it hurt me. For one, that's how I could describe it. I work with Dr. Nigatara from the BBC, and she describes it beautifully. We often get a Muslim woman come to us as clinicians that says, I'm in too much pain, doctor. And we put her on a load of painkillers and send her to physiotherapy. But what we don't know is that poor lady has no language. And, language is so important in healing. This Muslim lady is probably saying she's feeling overwhelmed, anxious, maybe depressed. She's feeling, stiff in her joints, but she hasn't got that language to say. So she'll come to a Western doctor and say, I'm in too much pain, doctor. And we put her on a load of painkillers and send her to a physiotherapist. And so, as clinicians, we really need to expand our language into the word pain. When I'm working with clients or patients now, I absolutely discourage that word because it's just a blanket that we associate with there is something wrong with you, you've broken a bone, we need to fix it with drugs or surgery. We need to be feeling more. How am I feeling? How is my body feeling? And if I went around now around the local village and said, how's everyone body's feeling? I'm sure everyone would say, well, I'm knackered. But if I was to lie them down and start doing some Pilates with them or some somatic movement, how is your body feeling now? And then get them to identify different parts of their body. Where is that tightness? Where is that discomfort?
Can you talk a bit about the kind of Pilates you do then? Because it's not, there are a lot. I mean, Pilates, when people hear the word Pilates, they just think of it as the bog standard Pilates. But I'm assuming you do something a little bit different.
I do. And I could talk about the Pilates industry, but I think really to make it more appropriate, I'll talk about how it healed my body. And so the first Pilates teacher I had, she was 74. She'd healed herself from a very severe scoliotic back. And she moved like a swan. I put that in my website. She moved like a swan, but she did. And she inspired me. And she helped me get off all the medication. But she was using traditional, original Joseph Pilates equipment in a classical studio. So I'm talking a trapeze, a reformer, but not like the reformers in these reformer studios. Something called the ladder barrel, the spine corrector. And all of this equipment gives you feedback into your body. So somebody with CPTSD or trauma is not in their body. They're disconnected. Their mind and body are separate. But when I'm on this equipment and I've got a Pilates teacher with her hands on me, again, important for feedback, especially from a human, touch is so powerful. And you're touching the fascia, which is, a network of our nervous system that we don't talk about in Western medicine, but our fascia is our language, it's our body, it's our memories. So you're working with the fascia, you're working with trauma, their memories. And when someone's got their hands on you saying, this is safe, then you've started the process of healing. So I had this Pilates teacher for over a year, 1-to-1, twice a week. I did my homework. I was dedicated. I wanted to heal, but I was enjoying the movements. And this wasn't going home with a mat and doing hardcore exercises. This might have been just taking my knee out to the left and the right and seeing how that feels. And can I improve that movement? And my teacher was so kind and loving that I guess the child in me wanted to impress her. She was perhaps the mum I never had. And I wanted her to say, well done, and let's move on to the next exercise. So she encouraged me to be a Pilates teacher. And for that, I probably went to just about every Pilates class and studio in the West Midlands and even further afield. And there is so many types, and there's so many arguments in the Pilates industry. Mine's better than yours and all this lot. But really, what I was discovering was becoming embodied. So I'd found a movement in original classical Pilates with a good fascia-focused Pilates teacher that was helping me work with my nervous system on a one-to-one. Yes, she got me fitter and she got me out of pain. And then I went on to Polestar in London, which are focused on rehabilitation Pilates. And that fitted with what I wanted to do, and it combined with medicine. But, I now sit here. I mean, I'm all certified now. It was very hard work to do all that training. It was extremely expensive. I've had to travel all over the country to get mentorship. It wasn't an easy journey, especially at my age. And so I'm not someone who says, right, I've done Joseph Pilates work and I'm a Pilates teacher and this is how we do it. I say, well, this movement has changed my life. Are there any other movements out there? So I'm now exploring trauma-focused somatic yoga. I'm doing a course in May. I'll continue to do more Pilates courses to deepen my knowledge. But to kind of get 6 bodies in a church hall and say, all move this way doesn't fit with me, because I know that as individuals, I'm working with their nervous systems as well. And so really, if somebody wants to get fit and look toned and lean, and, Pilates is fantastic, go and get a good Pilates teacher. But if somebody wants to heal their bodies from alcohol addiction, lose weight, it has to go deeper than that. And I'd absolutely have to say, you have to find the right teacher. And your right teacher, may be a Pilates teacher, but she may be a yoga teacher. I think there's a lot of people out there calling themselves experts in the movement industry. And my journey has been about finding the right teachers. I mean, I'm here in the East Midlands living now, and I haven't been able to find a good teacher for my body at all. So I'm going to move, to find a good teacher. And I found a good teacher in Norwich. And so I will move there because I'm taking this body to the grave. Yeah. And I need to make sure that I have the best teachers to help me to continue to heal it.
Yeah. I understand about finding the right teacher that you can resonate with and helps you through your individual problem. And I'm a huge advocate for when you have issues going on, whether it's trauma or something in your body, you need to look at yourself as an individual rather than, oh, that yoga teacher or that Pilates teacher or that ex-teacher is teaching everyone the same thing, because no, my body is different to yours. Yeah. And that may or may not work. And if it doesn't, and I continue paying X amount for the next 3 months and I'm still in a similar situation, well, then what? You know, if people aren't able to move to find the right teacher or go and to an area that's close enough, what do you recommend then? How long do people keep searching for the right kind of person?
You have to keep searching. And this is the journey of life. This is what the universe does for you. So I get moments at the moment. I was a little bit stuck in fear a few months ago, thinking I'm not progressing with my movement. I'm not enjoying it because I'm trying to do it on my own. I've been so disconnected from my body. When someone says, can you feel that in your glue? I'm still, no, I still can't feel it. You know, I've discovered other issues as well, like it's okay moving muscles and exercising muscles, but I find I'm constantly holding and gripping. So sometimes people don't need exercises. They need to learn to let go. You know, so finding that teacher, I never give up. I never give up. So I gave up in the East Midlands thinking, you know, I can't find a good teacher. There's one about an hour away, but ideally I'd have all these people under one roof. So I would say to anybody, you don't stop trying to find that teacher. And if I go for a one-to-one, I don't usually give up on that teacher on that one session, because it's hard to establish anything on a one-off session, whether that's a therapy session. I'm quite persistent to give people a few tries. And it's very expensive to find the right teacher. Yeah. But then, and I get this all the time, people will say to me, well, I can't afford this and I can't afford that. I get it, you know, when I work in GP practices and urgent care, and I'll sit there and say, you know, I'm probably a little bit harsh here, but I'll say, you've just put your car keys down there and you've got an Audi. Your shoes are Nike trainers and you've got a brand new iPhone. You know, so that, this is about money. But, you know, there are people who genuinely have nothing.
Yeah.
Have nothing. And one of the reasons that I wanted to train to be a Pilates teacher is I've had nothing. I've lived under that caravan, and there's been lots of moments in my life when I've had nothing. I've had no work. You know, my money went on alcohol and things. And so when I trained, I said, wherever my journey and, you know, wherever it goes, and my big dream is to have a big wellness centre where I do trauma healing, where I have a Pilates studio, a cookery school to teach people to cook good food, animals, meditation, a clinical area so we can look at things clinically. But if all that was under one roof, then absolutely I would give my services away free to those who had none, have no money, because that's what the universe has put me here for. So we're in a culture, and whenever I approach Pilates teachers and the first thing they talk about is packages and money, and it really puts me off, because I want to come from a place where I'm going to say to people, I've learned all these tips and tricks of the Pilates teachers. I know how to shove people, get them in the right position. But I don't want to keep taking people's money off them. I want them to be able to do this themselves. And I will teach them. And ideally, I would like people to come to me for a few one-off one-to-ones, but I'm going to give them all the knowledge they need. And I will throw things at them. But this is where they will have to do work as well. They'd have to be on board. And then I can say to them, you may only have to pop and see me once every 6 months or a year, or if you have an injury, because we are humans, we'll get sick and injured and have accidents. And so really, I don't want to keep taking their money off them. I'd rather they spend their money on other things like good food, holidays with their family, where they can feel sun on their face and get out in nature and enjoy life, rather than be in this culture of we work all day and then we come home and have wine and eat crap food and let's sit in front of the TV and spend hours on a phone that is not good for our brains.
Yeah. Well, I mean, it's a cycle a lot of people are in, and it's hard to get out of that. But when you're trapped in that and you keep doing it, you had a realization where you got done for drink driving. And I know I'm talking about that extreme, but for the person that, isn't going to get done for drink driving, what do you suggest? How do you even snap out of that?
Brain training. So you've got to start with understanding how your brain works and why you're doing what you're doing. And I can guarantee that if there's anybody doing this, that there'll be some underlying trauma. Now, mine is an extreme of horrific childhood abuse, CPTSD.
Yeah.
But there's a lot of women out there that have had a lovely childhood or whatever, but they've been in traumatic relationships with men. They've had horrendous jobs where they've been bullied. And that could be classed as PTSD. There's lots of information out there about trauma now. But or childhood trauma could be that they were emotionally neglected, or they lived with an alcoholic father and an alcoholic mother. That's childhood trauma. That is absolutely childhood trauma. So when someone's stuck there and they're saying, well, I know I should be doing this, and they're probably scrolling on their phone while they're thinking that, then they have really got to change and start by being small. It's by listening to the right podcasts. I think, if you can't read and you can't focus, Gabor made The Body Keeps the Score, an amazing book about trauma and how we get stuck. So every day, we have to think about what are we as humans. And I would urge anyone to just start to feel. So instead of the thinking, we're always in our left brain in the Western culture. We need to start using our right brains more as a primate. And so when you're kind of laying there scrolling, going, well, I heard what Angie said and I really want to do it. How do I do this? Instead of saying, well, I'm going to look on my phone for this podcast, put the phone down, put your one hand on your belly and the other on your heart, and say, how is my body feeling? And start to listen to, because once your body starts talking to you, it's incredible. You can start to, this disconnection with our body of, this body's just there to get me to work and to perform tasks. You become what they call embodied. And when you're embodied, you can tap in and you start to love yourself, because most of us don't love ourselves. We punish ourselves. And so when we start to say to our body, hi, how are you? Thank you for getting me through the day. Thank you for walking all those steps. And part of this embodiment is connecting with nature. So I absolutely urge everyone, if you don't do anything else, start going for walks in nature every day. No excuses. I mean, I was working in a place called Alum Rock in Birmingham, which has to be the poorest area ever. There is no trees, there's no grass. It's such a sad community full of rubbish and real poverty, daily stabbings and gang warfare. And I worked in a surgery there and met the most beautiful people on this planet. And I used to walk down Alum Rock Road every morning. I used to do my 10,000 steps before I started surgery, at 6 a.m. And I'd see the sun rising, and then all the vans would start delivering all the fresh herbs and coriander. And so there was no park, so I would go around the veg shops and smell the coriander and the mint, and there'd be blueberries. And then the shop owner started to get to know me and what fruit would you like? And so what an amazing start for the day. So someone would say, oh, there's no nature in Alum Rock. I have found nature there. Yeah. It came off the back of a lorry, but I found things that are beautiful to my mind, fresh fruit, fresh herbs. That stimulates our senses and reminds us we're a primate. And that's my connection with nature. So when someone's so stuck, we start with little nature walks. So being mindful, you know, when you're going for a nature walk, I mean, it's coming up to spring now. There's so many buds around. You know, when you see a robin, I like this saying, seeing a robin is, a Buddha used to say that seeing a robin is like happiness. Remember that happiness is like a robin. It comes in fleeting moments. It's not always there. It will come and go, but there's lots of robins always around. You know, and those kind of things can make the day more joyful.
Yeah, I love that. You know, I'm just going to go back to the whole point of take your mind out of the daily grind that you're in, whatever that repetitiveness that you're doing, whether it's just scrolling on your phone, working 9 to 5, 9 to 9, whatever it is you work, you know, whether even if you're doing night shift, just take your mind and your body away from that. And it's taking those really small steps, you know, start with a minute, then 2 minutes, 3 minutes, build it up, I guess. And then you start tuning into your body. But really it's a choice. It's a choice you make. And also admitting that you have issues going on, or you might have issues going on, because if you don't see that there are, or admit that something is not going right for you, then how can you possibly address that?
Yeah, absolutely. You know, and I mean, I've just had to do a website, you know, which has traumatized me in a way. I hate IT, and doing a website was awful. And but you know, I will add a load of links and books that have really helped me on there.
Yeah.
But you know, knowledge is power. I remember being about 7 years old in a hospital when my mum had injured me. And I heard a nurse say to another nurse, that poor little child needs to get some knowledge. And I went to that nurse. I said, how do I get knowledge, nurse? And she said, you need to read a book. And I said, I can't read and write.
Yeah.
And she nearly cried, this nurse. And I said, please teach me to read and write. And she started teaching me that night. And everybody I could ever meet, I'd say, can you read and write? Will you teach me, please? Because I didn't go to school until I was 15. I taught myself to read and write because that nurse said to me, knowledge is power. And when you have the knowledge, it can change your life. You know, we have to learn as primates. If we're in a tribe, in a field, you know, and it's going to start getting flooded, we need that knowledge to expand, to get onto new land, to meet a new tribe. We can't just stay there and just let us die.
Yeah.
So we have to get knowledge every day. And whether we get that in the form of reading or a podcast, you know, and if you're scrolling on Facebook, on Instagram, looking for answers like that, that is not going to give you any answers. That is just killing your brain and wasting your life. You know, life is so precious. We are only here for a short time.
Yeah.
And when I went down to London to train to be a Pilates teacher, there's 14 of us, and I think I was probably I was the oldest. And they said, why are you all here? And everybody wanted to be Instagram stars or heal, you know, just get people fit. But they came to me and I said, I want to die with peace in my heart, because I have been so privileged to see so many people die. I have been at the end of so many people's lives and held their hand. And I have heard their last words. And they are very frequently, I wish I'd have looked after my body. I wish I'd have given more time to my loved ones. And the other one was, I have so much more I need to do.
Wow.
I don't want to die saying those words. I know if I die now, I won't say those words. I have found some peace in my heart that only my healing journey has brought me, through being more, how am I feeling rather than what I'm thinking. When
you're around people that are about to pass away and you hear those words, that really hits home. And I can imagine, I mean, you just saying that now, it's made me feel, God, you know, I'm guilty of a lot of things. And I won't say guilty of a lot of things in the sense that I do go into that cycle of, you know, anxiety, work, this, that, other, social media scrolling, and making sure I'm present on social media, and trying to step away from that and think, you know, what's around me, you know, my kids, my family, my friends. I have so many amazing friends and family, and I do want to spend time with them, and I do want to do things with them. And I'm sure, you know, if you're privileged to have that around you, you should, because we don't want to be on our deathbeds having so many regrets, because that's the worst thing. You know, you feel like, almost like, I'm not dying in peace, because I'm not at peace because I didn't do all these things that I should have done. That's horrible. That really is horrible.
And it's very sad, and I've seen it so many times. But, you know, I guess really, you know, going back to that being under the stars, you know, what is my purpose on this planet? Well, I'd love to heal everybody, but I can't. But the universe will send to me those that I can help, and I will give it all of my energy to help those that need help. And it includes those, you know, if they come from Allen Rock and they've got no money, that then that they will get my healing still, you know. And you know what? Yeah, there'll be people who can't afford to pay, but you can get money from the government through charities and things like that to, you know, as long as I've got enough money for food in my belly. You know, I've got a £300 Vauxhall Corsa, you know, that's on its last legs. But in my lounge, I've got a £7,000 reformer that helps me keep my body moving. That's my priorities. You know, where do you put your money? We all need to earn money. But, you know, if someone comes to me, I mean, I've had people come in for freebies, and you know, when I've heard they've been going for a facial and things like that, then I have to work on my boundaries and think, no, I'm not doing this for free when they're doing that. Yeah. But, you know, when somebody is genuinely working so hard and trying so much, then we have to help them as humans if you can genuinely see their suffering. And, you know, one day I hope to be able to train people to do what I can do so we can expand this love. And I think that if we keep putting money first, well, of course, we all need to earn money, and we like, you know, of course, I like to go on holidays. But if we keep putting money first, then we're forgetting the focus of us as humans, that we should be helping each other with love and compassion. And in a way, a lot of what I do, you know, I might be, you know, I'm moving to Norwich, and someone out there has kind of said, oh, can you do Pilates? And I noticed they were Vietnamese, and I said, well, I'll do one-to-ones if you can cook me your food, because I love Vietnamese food. So I kind of love this exchange of bartering. You know, it's kind of more humanistic and kind.
For me, a great life and great healthcare is not just for people that can afford it.
No.
We are, I would say, the minority. The majority probably can't afford that amount of money to go to an event to learn about something, or to help themselves, or go to a Pilates class, whatever it might be. So if I can then tap into the communities that can't afford it, and also, you know, give them the knowledge and get them on their way to their journey for better health and better wealth, that's, you know, I think for me as well, it's not just about helping people that can afford it. And also, if you can afford it, you know, it's priorities. And I totally get what you said, you know, and I do this. I'll happily, maybe I'll buy I don't know, something from a high street shop like Zara or whatever, a top, and it might cost £30-40 or whatever it is. And then when I see someone offering a class that's, I know that might make me feel relaxed or whatever, and it's £40-50, I'll say, oh no, that's quite expensive. But I'll go and buy that top that costs £30-40. So it just doesn't, the two don't add up.
It doesn't. And, you know, I really must say now, I must urge everyone, you know, whatever money you earn, your first priority after keeping your family safe, roof over the head, food in their bellies, what does my body need money to be spent on?
That's brilliant.
I always do that. That's why I've got a £300 car. That comes last on my agenda. That's not coming to the grave with me.
Yeah.
So whenever you're just earning money, you know, the first thing after keeping your family safe, Your body's the only thing taking you to grave. Spend some money on it. Invest in it. Don't invest in stocks and shares. They're not coming to the grave with you.
Yeah.
Even that lovely holiday you want, that Rolex watch, that handbag, they're not coming to the grave. Your body is. Spend some money on it. It will thank you. I have spent 30,000 on my body rehabbing it.
Wow.
Because, over 5 years, that's therapy, that's going on retreats, that's going on lots of things. That's buying my reformer, that's doing all my Pilates training. It's an horrendous amount. Is it an horrendous amount of money? No, it's not. No, it's not. I've prevented so many diseases. I don't need hip replacements or knee replacements now that I'd have to pay for. Spend money on your body. It will thank you in so many ways. Find a good teacher, invest in them. When you find a good teacher, don't let go of them.
Yeah.
And if they're kind, they will fit around what you can afford. But, please, whenever you've paid your bills, the next thing on your list is your body. It's precious. I've tried to kind of tap into the NHS and offer my services for the well-being of staff.
Yeah.
But, I'm frequently, I'm always met with resistance. Yes, I mean, I work full time and work in Pilates and all sorts of things. But I still, after, even if I'm working in a surgery, I'll go for that nature walk before work. There's moves I can throw in during the day to keep my body well. The food I take to work, because I would never eat in a hospital, ever. The food is awful there. I take good, nutritious food to work to look after myself during the day. But I see my colleagues have no energy. They're drinking sugar. They're eating really awful, ultra-processed food.
Red Bull.
And so they're making themselves sick. But they are believing the consultants, who say, the Mediterranean diet fixes everything. We're so out of date in Western medicine of what healing truly is and what good nutrition and movement is. And so my colleagues, really, a lot of them are sadly suffering like I did, can't wait to get home to that glass of wine and rest when really they need to be moving more, but finding a movement they enjoy. And that, again, is back down to that challenge of somebody on the settee. Where do I start? You've got to really want to do it. You've got to really want to do it and have a passion for wanting to live.
I hope some of these messages really help, because when people are on their deathbed, to the things that you've been through, I just hope some of the messages get through somehow. We're also caught up in whatever's going on in our lives, and we just don't take a minute to step outside and think about what we're doing with our lives. For anyone listening who might be going through stuff, who can't find the time, hasn't got the money, whatever's going on, what advice do you give to get out of that situation that they're in, to heal their mind and their body? What can they do? What top 3 things could they do?
Do you know what? I mean, at the risk of getting bombarded by thousands of women, I would say, look, if you are really that stuck, when I've been that stuck, reach out for help. And if that means someone's listening to me now and they say, I want to contact Angie, you're going to be able to give them my website details. My contact details are on there.
Yeah.
I'm running a retreat in September in Greece. I've got a retreat in Greece with an amazing bunch of ladies in America. I'm going to be the movement teacher and healing trauma and pain, but reach out and ask for help. That is the first tip. Number 2, try to look at trauma and, what is my pain? What is my underlying trauma? How do I heal trauma? Don't worry about losing weight and that. Heal your trauma. The rest will come. It will fall. And the third one, treat yourself with love and compassion, because you all deserve it. And we all deserve to die with peace in our hearts and love. And I'm just going to go back to number 1. Reach out for help. Yeah. And if someone says, I really do need to speak to Angie, I would absolutely talk to anybody, because that's what we're on this planet for. Yeah. Because if we all get stronger, we can help each other.
You talk about trauma. Now, what if you think, well, I haven't had trauma. I don't think I've had trauma. What is that even? I don't feel like I've had any trauma in my childhood or adulthood or anything. Then what?
I do get that, but people don't, when we talk about trauma, we're thinking of horrific incidents here, but just even having a baby can be traumatic.
Right. Yeah.
Your child not doing things at school right, or it's been diagnosed, that's trauma. What's the definition of trauma?
Yeah.
Trauma is things that are uncomfortable and painful in our life that will affect us moving forward. It keeps us stuck. And that might be just scrolling on Facebook and wasting time arguing with people. But, when we're stuck in trauma and worrying about the past or worrying about the future, we're stuck. Yeah.
No, thanks for clarifying that, because I know a lot of people, when they hear the word trauma, they think it's a really big thing.
Yeah.
A huge explosive event or massive event in their life. And it doesn't have to be that way. Trauma can be as big or as small. It's not trauma's trauma. It doesn't have to be this huge thing. But Angela, thank you so much for being here with me today. It's been a beautiful, beautiful conversation, and I really hope the listeners get something out of this. Thank you.
You're welcome.
Thank you.